Dr. Rapaport, good morning.
John, as always, it is a beautiful day in Los Angeles.
So we have picked up a little tidbit from the insurance companies, and that is with regard to Dupixent and the prerequisite for approval for Dupixent. And we're getting reports that insurance companies generally are requiring a biopsy before they will approve the use of Dupixent.
That's interesting. I have seen that. I'm not sure how it originated or from where it came. We have heard other things about the Utah insurance company denying approval, paying for Dupixent. Not this part about biopsy, but maybe the word is spreading. I'm not sure what they expect to get from a biopsy other than ruling out lymphoma or what? A bad dermatitis? Does that mean they're not going to pay or they are going to pay for the Dupixent? I'm not sure, but it sounds like an attempt to save money on a medication that has not been working well.
Or if somebody's got lymphoma, have we missed the diagnosis and we're going to give them the Dupixent? I just thought it was curious.
It's outlandish because the information for the biopsy is going to be no better than what your eye sees. If it's a thin little redness, that's what it's going to show in the biopsy. It doesn't show anything more. There are no strained cells. There's no tumor. Lymphoma is an outlandish diagnosis to make because there's this rare thing called mycosis fungoides that I've not seen in 40 years that looks red, but it acts entirely differently than the red-skinned people and the steroid-addicted people. And I'm suspicious a lot of the early mycosis fungoides patients who presented with tumors and rashes were all put on high-dose steroids, topically and orally, and could have become addicted to the steroids also, and got red from head to toe. It's hard to say, but I'm suspicious that's what happened. It was not a typical manifestation of MF. Things are afoot, and I'm suspicious of cost saving going on. This morning, the Wall Street Journal article about CVS looking at their pricing on the front page. I'm not sure, I didn't read the whole article, but they're reevaluating how they're pricing things. You see it in the restaurants, you see it everywhere. There's a reevaluation of how much to charge, how little to charge, how not to support certain medications anymore, not to allow it to be refilled anymore, not to allow it to even be on the shelf anymore because they have been valueless. Interesting. A little bit of a revolution, but it's time. It's nothing wrong with being straight and honest and having a revolution every once in a while that clears the slate clean.
It's from a little bit of an unlikely source, though, the insurance companies pushing back on, I guess, over treatment, over medications, anti-serial visits to the physician, that sort of thing. It's curious.
Well, you bring up a huge philosophical problem. I'll tell you my thinking on this and my opinion, which could be totally accurate or I'm flirting with a problem area. We don't run the show anymore. 50 years ago, 100 years ago, doctors ran the show. They demanded, they got whatever they wanted. They got every prescription filled. They filled their own prescriptions. They had the stock in the back room 100 years ago. They told the pharmacists what to do. They told the drug companies what to make and manufacture. They are under the gun of big corporations, business corporations, many, many doctors, offices. Here in LA, there are three big boys, four. Cedars, UCLA, Provident, and USC. They own many practices in all of LA. That's LA, and we're an avant-garde new city. It surely goes on back east.
And it's all formulaic.
All formula. And they're told, the doctors are told what they can prescribe,
Yeah.
are told how many hours they got to put in, are told who not to see, are told what not to prescribe.
But
They have
beyond
no
that,
control.
as a patient, if you go in and see that general practitioner, and some of your blood work is outside of the range, you are now at a nephrologist, you're now at a cardiologist, you're out at a rheumatologist, you're seeing. I mean, right? You just all of a sudden you're on the merry-go-round.
Yeah. Very, very disturbing. Nobody holds my hand anymore. They only are interested in one little part of my body. I tell them I got a cold. Would they mind giving me an antihistamine? Oh, no, it's not my field. What, are you kidding me?
You got to go to a pulmonologist.
Yeah, you got immunologist for a cold. I know. It's not good. It is not good. But that's what I see has been going on for several years now. And that warrants itself as a fairly good explanation to answer your question.
Well, I appreciate you doing that. Thank you. We'll see you again soon.